Time to talk about our health now. It's almost hard to remember life before the amazing healing properties of antibiotics, penicillin, amoxicillin, drugs that really revolutionized healthcare.
And with all medications, they're effective and safe only when used as prescribed and directed.
Absolutely. There's a lot about antibiotics we may not know, and that's why the CDC has named this week as National Antibiotic Week. So I stopped by my neighborhood Meijer Pharmacy to track down some important information about antibiotics. Okay, of course, we're talking about the cold and flu season starting up, and it's important that we start to talk about and think about the importance of antibiotics as we manage our family's healthcare concerns. Jamie Vroman is the Regional Clinical Services Pharmacist from Meijer, and Jamie, you're here to tell us that we need to pay careful attention when we're thinking about using antibiotics.
Very true. This week is actually Get Smart About Antibiotic Use. So that program has been started by the CDC ever since 2008 because there's something called antibiotic resistance that is, of course, emerging. And we want to make sure that when we do treat a bacterial infection that we're getting the most from the antibiotic use. So we don't want the improper use of antibiotics.
What's the danger when we're improperly using antibiotics?
The bacteria actually can get stronger. So they form new ways of getting around the antibiotic use. And then it becomes harder to treat and more expensive, and the illness can be more severe.
What's the big concern that people maybe don't take them according to the doctor's use, or doctors over-prescribing antibiotics?
It's a little bit of both. The over-prescribing of antibiotics has definitely improved since 2008 and the emergence of this program. But there is still a lot of stockpiling of antibiotics in the home. And if the patients are prescribed a 10-day course, some patients only take it for a few days, they start to feel better, they stop, and they save it for a later date when they're ill again. And they could have a different infection, they could have a virus, which isn't even treatable by antibiotics. So there's a lot of different variables in there.
And so as part of this, Meijer is on a huge education campaign, really partnering with us in our family's health care.
Absolutely, absolutely. Right now, like you said, the flu virus, cold season, we're really starting to get into that. It doesn't usually peak until February, but with the cold weather coming, we're getting into it now. And virus is influenza, and colds are typically virus as well. And antibiotics do not work against viruses.
Okay, but if somebody does need an antibiotic, money does not have to be a concern because you guys are actually doing something really almost revolutionary, offering free antibiotics.
Yes, we have 6 different free antibiotics for the family. So it is easier for the patients to get the help that they need when they do need an antibiotic.
Tell us about the partnership that you have with your families. If someone is using pharmaceuticals on a regular or even on an irregular basis, you have a great computerized system that helps people keep track of their family's health care.
We do. We obviously have patient profiles, so any drug interactions when the patient brings in an antibiotic or any prescription, we have the ability to screen those. So it's just, again, promoting better health and watching out for dangerous side effects that can happen with medication use.
There can be some interactions that make some medications
ineffective or potentially at higher doses, which can cause some serious problems. So yes, it's a very important thing that we know all of your medications so we can screen them when you're getting things like our antibiotics.
Fantastic. So Meijer Pharmacy, the focus this week is on antibiotics, but of course all year long keeping you and your family healthy and safe, starting here in the Meijer Pharmacy. And you know, it's something I really had never considered, the proper use of antibiotics, of course, as such a huge concern among the healthcare world, worldwide, specifically the Centers for Disease Control, or CDC, and that's why this week is the annual Get Smart About Antibiotic Week.
And Meijer pharmacists want to remind us all of the important safety issues. Never use anyone else's prescription.
Never keep prescriptions past their expiration dates.
And when a doctor prescribes an antibiotic to a patient, that patient should take that prescription as written until complete.
Antibiotics should never be stockpiled, and you should not stop taking them if you feel better. That's the big problem. It'll lead to the resistance of antibiotics and the term super bugs that we're starting to hear more about.
Oh yeah, and make sure to dispose of medications properly. You can get that information at your neighborhood Meijer Pharmacy.
That's right, and Meijer, of course, so committed to being an affordable partner in our family's health care, and that's why there are a select number, 6 antibiotics that are available year-round, free of charge, which is really great. And the concern too, those interactions, you want to have all your family's prescriptions at one pharmacy, and that way your pharmacist is kind of that point person for making sure you know how things are going to interact or react with each other.
That's right, and especially taking medications until they're gone, not when you feel better.
Exactly. Oh, yeah. Well, fantastic. Okay, great information there. Lots more straight ahead. We'll be right back.
That's West.